In the mountain villages of Burma, disease and malnutrition are constant threats. Without safe water, electricity, sanitation, or medical care, when someone gets sick, even common illnesses are life-threatening. The risks are greatest for children and new mothers. The mortality rates are staggering, with 1 in 7 children not living to see their first birthday, and 1 in 12 mothers dying as a result of childbirth. Preventable illnesses, such as malaria, pneumonia, and dysentery, are the leading causes of death, and 60% of children's deaths could be prevented with access to basic medicine, if it were available. These conditions are not new or unknown. For the last 60 years, the military regime has oppressed the ethnic minorities of Burma. The reforms made over the last few years have been empty promises. These people want nothing more than to follow their traditional ways of life. Yet the regime's violence has displaced more than 500,000 men, women, and children. Many of these families found sanctuary in makeshift camps in isolated mountain areas. The international community is largely denied access to these remote areas. Instead, it focuses on the country's reforms, such as inclusion of pro-democracy advocate Aung San Suu Kyi in the parliament. Yet for the villagers, conditions have only worsened. Since 2011, the Burma Army renewed its assault on the Kachin people in northern Burma, displacing another 220,000 people. The cause of the violence is the regime's desire to control the land and the resources found there. Villages and families who have farmed for generations have lost their means of support and their livelihood. The countryside is being turned over to international companies to develop and exploit for mining, lumber, and hydroelectric projects. The land and water are destroyed, making both unfit for human use. But there is hope. There is good news. From among these peoples, the community-based backpack medics have risen. The medics bring medicine and experience to their people.
Our backpack medics are 3 to 5 men and women. They travel between villages where they are. The medics are the only medical care available to the villagers. They treat people with the illness like malaria, pneumonia, and they also treat those injured by gunshots and landmines.
Some teams travel between 9 to 12 villages each month. Others have a fixed permanent location and travel as necessary to nearby villages or camps to help when children and villagers are too sick or injured to hike to reach care. Where the medics are present, there are positive results. Malaria and dysentery deaths are down by 50%, and maternal mortality is reduced tenfold. The medics have shown repeatedly that basic medicine, such as penicillin, can prevent 60% of children's deaths. The backpack medics are an example of true capacity building, helping those in need care for their own people. They have the will, they have the determination. Burma Humanitarian Mission supports the medics by providing training and medicine for the teams. Last year, we supported medics who treated over 11,000 patients, including treating over 500 malaria patients, 2,500 patients suffering from pneumonia, and assisting in the delivery of more than 520 babies. This year, we will increase our support to 16 medic teams, providing over 1.2 million doses of medicine, and helping more than 30,000 children and their families. Through Alternative Gifts International, you can be part of giving hope to the children of Burma and their parents. $1 will provide 40 doses of medicine. $8 will provide a medic team with the medicine needed for a day. Your kindness can help fill backpacks with medicine, and a future.